Good afternoon, everyone. I'm Mary Funseth. I'm from Superior Health, and we want to welcome you to Back to Basics webinar series. For those of you who have joined us before, we're really glad to have you come back. And if this is your first time joining us in this webinar series, we're glad to have you. As I mentioned, today's session is part of a webinar series, and webinars are the third Tuesday of each month and occur at 12 p.m. Central, 1 p.m. Eastern Standard Time. On this slide, you're going to see some of the future topics that we're going to be discussing. And as you can see, next month, we are going to be talking about end-of-life advanced care planning. So today, our learning objectives are to analyze the importance of addressing patients' self-management of their chronic conditions. We're going to examine how living well with chronic conditions can be helpful to a patient's plan of care. And we're also going to be able to advise others how to find chronic disease self-management education programs in your state. Now, we will begin with the Wisconsin Institute of Aging representative, Jill Renken, and she's going to explain the program and some of the Wisconsin opportunities. After she has finished, we're going to have Andrea, one of our Superior Health Quality Improvement Advisors, tell us about Minnesota and Michigan in using and availability of that program. So we really would like to ask you to stay present throughout the entire presentation. Next, we have a polling question. So if we can launch that polling question. There's the question. Please take a moment, answer. And if you'd like to close that polling question. So this gives you this is a great opportunity today, I see. So great, that's wonderful to see this. We are right on topic. So next, I would like to introduce to you our very first speaker. And Jill Renken is from Wisconsin Institute for Healthy Aging. We are very proud to work with this group because we have had a very long-standing relationship with them, and they are definitely doing a great job in our area, providing us with more than just living well with chronic conditions. So I'm going to turn it over next to Jill. Welcome, Jill.
Thank you so much, Mary, and thank you everyone for joining us today. I am really excited to be talking with you about the Living Well with Chronic Conditions program, which is also the Chronic Disease Self-Management Program. It's a nationwide program, which is why you're going to be hearing about it today in a variety of different states. But it is, I will say, it is one of my very favorite programs. I probably is my favorite program. So that's why I'm so excited to talk with you about it today. Just to give you a little bit of background, so I am currently the executive director of the Wisconsin Institute for Healthy Aging, and I've been with the organization since it existed, and we actually started administering this program throughout the state of Wisconsin, even before Wisconsin Institute for Healthy Aging was formed. It was formed because of the success with this program and others throughout the state of Wisconsin. So it's been very exciting to see it grow throughout the state of Wisconsin over the past 15 years. I am also a facilitator of this program, so facilitated a variety of programs in community settings, as well as a master trainer, so training people throughout the state of Wisconsin on how to be facilitators to implement this program in their community. So I've been working with it for about 15 years. My background is in training is in health education. So that's what I'm going to talk with you about today, is not only the program and logistics of it, but really the theory and behavior change status behind the program, which is why it complements clinical care so well. So That's a little bit about my background. I'll tell you a little bit about the Wisconsin Institute for Healthy Aging and how we support this program. So our organization was created because of the success, like I said, of the evidence-based, community-based, evidence-based healthy aging programs throughout the state of Wisconsin. And our mission is to advance healthy aging and improve health and well-being of all people as they age. We do this by disseminating those evidence-based programs and practices throughout the state, as well as our mission has expanded to engage in collaborative public health strategies also. And some of our programs are available nationally. So we have national spread in some of our programs as well. Next slide. So as you are all probably very well aware that we have many components to people's health and self-management. And we know that at least 30% of people's determinants of health are related to the personal health behaviors. And that's one thing that we know that is addressed in clinical care, is wanting to pull that personal self-care into their well-rounded approach to healthcare. So we see that we have a strong partnership and a strong complement with these programs to the clinical care access and quality to healthcare, and definitely see that as a great partnership. Next slide. So our organization takes programs and health education from research to practice to people. So all of our programs and all of our health education information that we disseminate throughout the state and nationwide is all evidence-based. So whether that is evidence has been established to be able to receive certain health outcomes through other organizations, such as the program I'm going to be talking about today, or other programs that we have researched ourselves here in Wisconsin. We have a very collaborative partnership with the University of Wisconsin-Madison and researchers there. So many of our programs were developed here in Wisconsin and then researched and proven throughout the nation. So that goes to show that just as far as that goes, we want to make sure we're maintaining that evidence-based information with all of our health education that's coming. And then we assist with getting these programs into practice. So how do we replicate these programs and get them throughout the state and throughout the nation? And then really it's the local communities who are doing the amazing work of implementing these programs. Next slide. So just to give you an idea of our partnerships, we are partnered, like I said, with the University of Wisconsin School of Medicine and Public Health, lots of different institutions that we're working with through the university system, as well as Wisconsin State Public Health and Aging Policy Agencies, very close collaboration with the Department of Health Services. And then to jump right to healthcare related organizations, we have on our board of directors, as well as many of our partners and some of even the program providers that are providing these programs in the communities are healthcare and related organizations. About a third of the program providers that are implementing these programs in Wisconsin communities come from healthcare organizations that are partnering either on their own or they're partnering with their local aging and disability resource centers or public health departments and so on and so forth. So you can see that orange box is those local community organizations that are implementing the programs in their communities. So it's a variety of different ones, senior centers, YMCAs, things like that, with primarily the biggest group coming from senior centers and aging and disability resource centers, as well as public health departments that are implementing these programs. Next slide. So I am going to, while we're going to talk about the Living Well with Chronic Conditions program today, I do want to just overview the other health promotion programs that we have going on. So you can just keep clicking through these. But this will give you an idea of the evidence-based programs that are happening here in Wisconsin. And all of them, the reason I mention this is because they all complement one another, especially the Living Well with Chronic Conditions program that we're going to be talking about. It's very well paired. There's other resources just to illustrate when people are done with this program. We will refer them many times into other programs to continue their self-management journey. So we do have the Living Well with Chronic Conditions program. We have the Healthy Living with Diabetes, which is the diabetes version of Living Well with Chronic Conditions, as well as Healthy Living with Chronic Pain. So I'm going to focus on the chronic conditions one, but know that we do have the diabetes specific version available, as well as the chronic pain available. And then you can see we have some physical activity programs, Walk with Ease and Physical Activity for Lifelong Success. We have a Stand Up for Your Health, which is a sedentary reduction program. And then our big Stepping on Falls prevention program that's also available in Spanish. We just recently unveiled our Pasando Fuerte, which is our Spanish cultural adaptation for stepping on. And then we have an incontinence program called Mind Over Matter, Healthy Bowels, Healthy Bladder. You can go to the next slide. And you can find more information about these programs on our website. So I won't spend obviously a whole lot of time today, but there is a lot of information, as well as all of the research articles are linked there. You're looking at what it'll tell you what the health benefits are of each one of the programs, but also the research behind it. Next slide. So just a little bit of testimonial so you can see like the impact that these are happening. Like I said, we've been doing these programs in Wisconsin for over 15 years, actually about 17 now. But you can see that this is a very simple testimonial for living well with chronic conditions, but this program changed my life is something that I heard personally from one of the people that was in one of my workshops. And I've heard it also many times after that. So that's why I like to put that there, is these programs do change people's life along with all of the other things that are happening in their healthcare. So, somebody who took the diabetes version, I never know how much my emotions affected my physical health. It helped me recognize stress signals and I pay attention. So there's other components to these workshops that are really helpful for people when they're managing their physical health. And then healthy living with chronic pain, realizing that circumstances can't be chosen, but they got as much out of the 6-week workshop as they got out of 18 months in a pain management group. So it just goes to show the benefit of these programs. And we've got lots of testimonials also beyond that. So thank you. Next slide. Okay, so why are we talking about it here? And how does this enhance and complement the clinical-based education and treatment plans, which are extremely important? So these programs, the goal of them, they will provide some general evidence-based health education information. So good basic information on, we'll get to the next slide about nutrition and physical activity and diabetes management, and all of that comes into play here. But really the focus of them is that it's increasing patient self-efficacy, which is, if you haven't heard of self-efficacy before, another word for it is confidence. So the behavior change theory behind how we implement these programs, how they are facilitated, not necessarily the content, but how they are trained to facilitate, will increase someone's confidence and self-efficacy so that they can take the treatment plan that they're getting from their healthcare team and then have the confidence and ability to implement that into their daily life. And that is the main goal of these programs. So it does give them just a general understanding of tools that they can use to to manage their health on a daily basis. But really that motivation and the skill development is really the focus of the program. So it's a great linkage between community-based education and clinical-based education, because many times people in these workshops will talk about, my doctor wants me to do X, Y, and Z, or I know I need to, blah, blah, blah. And then this program then helps them implement that. Many times we'll get questions about what happens if people have personal medical questions, and embedded into the curriculum in every single component of it is participants being referred to their healthcare team if there's personal medical questions. So those aren't addressed in the program. We are empowering them. We have a whole section on communicating with your healthcare team and how to best advocate for yourself, ask questions, involve the healthcare team, communicate effectively. All of that stuff is in the content of the workshop. We also make sure that we say that if any of the content is conflicting with instructions they receive elsewhere, we advise them to follow their physician's orders. So that's how we handle any kind of personal thing, but it's more so group-based. Next slide. So let's get on to living well with chronic conditions, because it's so awesome, right? So this program changed my life. So what is it? It is a 6-week intervention, and it happens in community settings. So it meets once a week for 2.5 hours. So for example, on Monday afternoons, for 2.5 hours for 6 weeks. This program will meet. Most of the time it's delivered in person because that is the most ideal. People we have found through the pandemic, the COVID pandemic, people still really want to do in person. However, it is available virtually and via telephone. So this program is happening in a variety of different settings. It requires 2 trained program facilitators, and it's mainly about peer facilitation. So these are not professionals can facilitate this program, and they do. We have a lot of health educators, a lot of nurses who are leading this program, but we also have peer facilitators. And that means that it's someone who has a chronic condition and has the tools and ability and desire to be able to help others. So whether it's a professional or it's a peer, someone who just has personal experience with chronic conditions, no matter who that is leading the workshop, the participants cannot tell which person is a healthcare provider or a health professional versus a peer, because the workshop is facilitated and designed to be implemented from people's personal experience. So even me as a health educator, when I am facilitating the workshop, because of the theory behind the program, we don't necessarily want them to know if you have any healthcare background, because the research behind the program showed differences in people taking the workshop with a health professional and a peer. And that while participants learn more, they learn from that professional. We feel that's the role of their healthcare team, that they ended up doing more. So their behavior change increased when it was led from a personal peer perspective. So regardless or not of my healthcare background, I'm going to lead the workshop in a scripted format that has the health education topics that we want to cover. But anything I'm talking about personally is from my personal experience. And that's the theory behind the program, which I'll get into a little bit later, is that participants then can relate to you and they can relate to the experiences. So then they're able to learn from each other and facilitate that group dynamic and group sharing. And then it's also available in English and Spanish here in Wisconsin, and as well as nationwide. So next slide, we'll go into a little bit more depth about the research. So what are the proven outcomes of this? So I'm going to talk a little bit about the healthcare outcomes here. And then in the following slide, we've got some other health outcomes like people's increased self-efficacy and confidence, and all of that kind of stuff also happens. But we do know from nationwide research that there's a 28% reduction in average emergency department visit and 22% reduction in hospitalizations in the first 6 months following the intervention, as well as better healthcare utilization. So total average healthcare costs averted by just the ED and hospital visits per participants is $714. That does go up with some of our other, like the diabetes version goes up to $815, and the chronic pain one as well. Currently, we have about 150 program facilitators here in Wisconsin, and over 11,000 participants have gone through the program in Wisconsin. So this program was developed and researched through Stanford University, and it is available nationwide and actually worldwide. This program is done. We call it Living Well with Chronic Conditions here in Wisconsin, but it's also called several different things throughout the nation. And it is evidence-based for any adult 18 and older that have one or more chronic conditions. And then also support persons are welcome and encouraged to join. So basically that's why this program is my favorite, is it really covers everyone. Like we're all dealing with something, whether it's chronic fatigue or anxiety or whatever it is. Like it doesn't have to be diabetes, chronic condition, heart disease, chronic pain. It doesn't have to be that. It can be just any general, it's a general wellness program, but it does really specify and focus on all chronic conditions. So the theory base behind the program, why it's appropriate for everyone, and is because we know that people that have chronic conditions are dealing with similar concerns and problems. So you don't necessarily need to have a class specifically just for people with diabetes. Well, we do have that version if it's of interest, but it doesn't have to have just people who are dealing with Parkinson's. It can, but we know that regardless of what people are dealing with, they do have similar things like fatigue, sleep, nutrition, physical activity, frustration, dealing with different emotions. All of those things come into play regardless of their chronic condition. Next slide. So these are the different topics covered in this program. I'm going to talk a little bit later about the action plans and problem solving, because that's one of the key components to the program. But as far as topics go, we talk about mind-body connection. We talk about sleep, dealing with difficult emotions, so that emotional wellness. We do whole exercises and skill building on making decisions. A lot of it making treatment decisions, like, do I take this, do I do this treatment or this treatment? And I have these options. Pain, fatigue, exercise, relaxation, better breathing. We talk about nutrition, healthy eating, just basics. Communication, like I said, with loved ones as well as healthcare team. We talk about medication usage and safe medication usage, informed treatment decisions, positive thinking. And then, like I said, that big section at the bottom of working with their healthcare professionals and organizations is a big section as well. But every single session, we do what's called an action plan, and we do problem solving, and that's short-term goal setting and problem solving. And I'll get into that a little bit later, but those are the topics. Next slide. So the different techniques that are used, and why is it, as far as increasing people's self-efficacy, how do we do that? And why? It happens in a group setting. So like my background in health education, health behavior change theory, this is embedded into this program. So we do things like brainstorming. So if we say, what are the causes of, or what are ways to help deal with pain? Or what are ways to help deal with pain or fatigue? Or what are the causes of pain and fatigue? So that's an example of one of the brainstorms. So then what happens is then you are starting a conversation with the entire group, and you set up the stage so that people can contribute their ideas. Like, this is how I deal with my fatigue, or I'll give another example of the medication management. What are ways that you're able that help you take your medication safely? Somebody will say, I use a pill box, or I use such and such, or I have this app on my phone, and everybody gives suggestions of things that they use to do this, and it's monitored in a way that it's safe, and things like that. Safe for people to contribute. So that fosters an environment for people to learn from each other, and then they have discussions. Oh, wow, okay, this really worked for you. That's a great strategy. So it's really cool how they're helping each other, and that's where that peer-to-peer facilitation happens. As well as they also increase their self-efficacy, because when they're giving ideas to the group and somebody says, that's awesome, I want to try that, or not even just the fact that they're contributing increases their confidence and increases the fact that they have something that they can offer, which then therefore gives them more confidence that they can accomplish the goals that they set out to accomplish, whether it's in their nutrition or it's in their physical activity. They have that increased confidence. So that's an example of how we use brainstorms in the program. And then we go through problem solving and decision making, which I'm actually going to jump to the action plan part of it right now. So every single week they'll make an action plan, and we make it very specific. So it's something that they want to do, for an example. So I love giving this example of a participant in one of my programs. Her action plan for the very first session was that she wanted to clean out her bathroom drawer. And it wasn't health related. We didn't tell her you need to do certain, work on your hydration this week or anything. We didn't do that. We present the topics, and then we say, you work on something you want to do. So she did. She wanted to clean out her bathroom drawer, and that was her goal for the week. So then when she came back the next session, and she picked something she wanted to do. So since she was successful that next time when she came back and reported on her action plan, she got kudos from the group. Everybody's clapping, great job. And then as we're talking about physical activity, we're talking about nutrition. Then her next action plan throughout the following weeks was, I want to walk. I want to, walk around that block. And so by the end of the 6-week sessions, she was walking, I don't know how many miles. It was several miles. She had a buddy that she walked with when it was happening. So she was a different person afterwards. And it all stemmed from her being successful with cleaning out her bathroom drawer. So that's how the theory of the program and the modeling works, as we don't tell people what they have to do, but then eventually they get motivated and inspired to then do those things. And then at the end, they are doing that health behavior that we want them to do. So that's an example of an action plan. So when people come back then the next week, we'll use the example. Let's say somebody said, I wanted to go to the YMCA and I wanted to walk on the treadmill, this X amount of times this next week, 3 times this week. They'll come back the next day and said, I only got in 2. So then what we do is we do problem solving with them. We facilitate this discussion where we say, well, then what happened? What got in the way? Oh, it was because my family was in town and I had company over and I didn't want to leave them, is an example. So we figure out what the barrier is. It's a whole process of this. And then the group helps them problem solve. Okay, next time that happens, then what are ways that we can overcome that barrier? And so then the group gives them ideas like, hey, you know what? You could have asked maybe ask your family to go on a walk with you. So you're not going to go to the Y, but hey, maybe you guys could go for a walk. So there's other ideas and things like that that people get from the group, and then they're empowered to be able to problem solve on their own. So that that behavior change can continue to happen and people don't just give up. So those are skills that are established throughout the 6 weeks. Next slide. So here's a sample action plan. Like I said, it's something that they want to do. It is action specific. So we will walk through it with them and say, it's not going to be like, I want to lose weight. It's okay, but what do you want to do? I want to start walking again. Okay. So the actions is walking. So how achievable is it? So we want to make sure that they're answering questions like, what are they going to do? They're going to go for a walk. How much are they going to do? Where I'm going to walk for, let's say I'm going to walk for 10 minutes and I'm going to do it Monday and Friday. So what days of the week, and so how often it's going to occur, and I'm going to do it every morning. So we get really specific with people, and so that it sets them up for success. They have a plan. They can write it down, whatever they do. And then we ask them what their confidence level is. So how confident are you? On a scale of 1 to 10, how confident are you that you're going to accomplish this whole goal, that you are going to walk both Monday and Friday for 10 minutes? And then they'll say what their confidence level is. And if it's anything less than a 7, then we'll go through and we'll do problem solving. So if somebody says, I'm at a 6, and then we'll say, okay, what kinds of things are getting in the way of you being confident? And they'll say, well, maybe it's supposed to rain this week, so I'm not super confident that I'm going to get it. Okay, then let's problem solve. Well, how can you overcome that? So maybe they'll change their action plan a little bit to say, I'm going to walk inside. Or maybe they say, I'm going to ride my recumbent bike or something like that inside instead. Or I'm going to go to the mall and walk. So there's different things that can happen that they can adjust that action plan, that we set them up for success. Because the goal is not that they're doing the behavior, ultimately we want that, but we want them to be successful because that increases their self-confidence. So that is an example of an action plan. All right, next slide. And then we celebrate success in the program a lot. We know then that this is what I was talking about, that participants who then complete this and they go through the 6-week workshop will experience improved health behaviors. We know that through the research that they have improved their health status, their self-reported health status, improved coping skills, education, and overall quality of life is reported. We know decreased days in the hospital and decreased ED visits happen as well through the research. So some of it's self-reported, some of it is actual data that we've collected, and throughout the whole nation that's collected this data. I will say that the diabetes version also has more specific health outcomes to it, where we have decreases in A1Cs and blood sugar control, or increased blood sugar control. So all of that does happen with our partnership, actually, with you all and with Metastar and Superior Health. So we have done a lot of measurement throughout the years on this. So those are the great successes that are coming from this program, as well as the general, I believe, the improvement in just socialization. These programs offer socialization for people. Not everybody loves to have a group workshop, but when they do get in it, they love it. It's very hard. We have a hard time sometimes getting people into the program. Sometimes they're not aware of the programs or really what it's for. But every time the program they get into it, our retention is really high. So people aren't leaving once they're there. They really love it. The satisfaction is there. So now it's just a matter of how do we get people into the programs. Next slide. So this is where you all come in. How we partner is number one, obviously just awareness that the programs exist. So your healthcare teams can be making referrals. You yourself, anyone can make a referral on our website, and I'll show you a little bit what that looks like. But it's super easy. We've made it incredibly simple to be able to do that. I say that also understanding that there's a lot of workload when it comes to in our healthcare system, but that is available to make a referral into the program. Also, just being aware and talking about it with people, they can themselves go on our website and see where the programs are happening because we all have that on our website. We also offer the opportunity. We do training, so becoming a program provider, so a program partnering with a local organization or doing it yourself, you can become trained and be a facilitator for these programs. Another option that actually is brand new, that's not even on the slide, is we at the Wisconsin Institute for Healthy Aging are now providing virtual programs of these sessions of all of our programs available for a small fee. So if an organization wants to purchase a program, purchase one that's happening and refer patients into it, that is available. If it's not happening in a certain community, then we have that virtual option. So those are different ways that you can partner with us for better health outcomes and for these programs. Next slide. So this is what it looks like on our website. It's just a quick make a referral button that you click, and it's super easy. It just asks for the patient's name and contact information, and then it's optional to add anything else in there. So it can be super basic. We've made it as short and as sweet as we possibly can for you guys. And then it's all secured, so HIPAA compliant and all that stuff. So the referral comes directly to us and we triage it. We can say, oh, yep, there's a program happening in this area of the state. If there's not, then we'll give them some options of virtual programs if they're available. So that is an option. But then there's also a section on our website where you can just go click on find a workshop. And it will just list all the currently scheduled ones that are happening, all the programs that are happening. A lot of times people like the referral button because if there's not currently a workshop scheduled in someone's community, or you don't want to go and do the hassle of trying to figure out if there is one or not, then you can just quick make the referral and we can handle it from there. So that's available for you. We also have handouts, as you can see, chronic pain, diabetes, chronic conditions, different health topics, just little one-pagers. We heard from a lot of our healthcare partners that were saying, hey, it would be great to give them like a one-pager of just some general health education information, as well as refer them into a program. So that is available on our website too. Next slide. And we'll talk a little bit about how this program, how you can find this in other states. So I will hand it over to you.
Great, thank you so much for your presentation, Jill. I'll just jump in really quick to talk about some resources for Michigan and Minnesota. I'm Andrea Boucher. I'm a quality improvement advisor with Superior Health, and I am based with Improve Health in Michigan, so I'll be sharing a little bit of information about that. So as the information that Jill shared covered Wisconsin, we want to make sure that we're all encompassing and sharing the relevant information for our other two states as well. So in Minnesota, you can find some research-based programs through the Juniper website, and that is available at the link on this slide. Juniper provides information on accessing evidence-based programs similar to everything that Jill had mentioned. There are resources for class leaders and also information on how healthcare providers can learn about and refer to those programs as well. Specifically, the Living Well with Diabetes program is available, and this website provides information about the benefits of that program and how someone can locate a class near them, whether you are a healthcare provider or are a patient looking for this information. And similarly, in Michigan, this information is housed on the My Healthy Programs website. This website has been developed to promote those evidence-based self-management and also physical activity programs that are available in Michigan communities. And it's also to support the partnerships that are active with implementing these types of programs. So as you're looking at the My Healthy Programs website, you can access programs such as Personal Action Towards Health, or PATH, which is the Michigan name for the Chronic Disease Self-Management Program. There's also the Diabetes Prevention Program, Wise Woman Program, Enhanced Fitness, and Diabetes Self-Management Education. So again, you can access all of this information at the links on these slides if you are based in either Minnesota or Michigan, and are interested in referring patients to any of these self-management programs as well. So I think with that, we will go ahead and take some questions.
Yeah, thank you, Jill and Andrea. It's a lot of information, but a lot of really great information, a lot of great success going on. And I know in Michigan and Minnesota, I'm sure you're having similar testimonials, and definitely those programs are out there and ready for you to send some referrals if that's possible. So let's take your questions now for either Jill or Andrea. And you may either put those into the chat or feel free to open your mic and ask us directly. So we'll just give it another moment for the questions. And do any of our teammates from Superior Health have any questions for Jill? Or anything to address or add on from the information we heard from Andrea?
So Jill, maybe I missed this because I was a little late in joining. I was just wondering, so people can use those links to sign or to refer some of their patients to the different programs in either of the 3 states. I was wondering too, what if any of our providers on the call today might be interested in joining with you to be instructors? Is that possible too, so that there's more programs for their patients to choose from?
Yes, absolutely. So also on our page, we have a For Professional section, and you can click on that and it says Become a Facilitator. And so that is a way, we ask that every organization register with us. It's like a 2-minute process just to let us know that they're interested in doing that. And then they can fill out an application to become a facilitator. There's a schedule on our website of all the trainings that are happening throughout the year. And there should be contact information. If none of those trainings are working out for you, then certainly contact us and we'll put you on a list. And we interest lists all the time are adding trainings throughout the year. So yep, lots of opportunity to become a facilitator if that's of interest to you.
Thank you, Jill. We happen to have a question, maybe the same question from Mary Fandrich. Even though this is a Wisconsin program, Minnesota can participate. And Mary, did we answer your question just now, or is it a little different?
So for Minnesota, they know what Andrea had provided would be what I recommend. There are several. I know Juniper and I'm sorry. Yes, Minnesota, right? Yes, Juniper is in Minnesota, and they're very equivalent to us at Wisconsin Institute for Healthy Aging. So on their website, I haven't been there recently, but I'm sure if you click on their website, they also have trainings available that you can get involved in or referrals. Yep.
Great question. And let us know, Mary, if we haven't completely answered your question or if you have a follow-up question. So Nicole has chatted in and Mary has said, yes, thank you. Nicole, how are patient outcomes measured? So that question would be to Jill.
Yeah, so it's been measured a variety of different ways throughout the years. Here in Wisconsin, we have a pre-post. And right now we're not measuring health outcomes. We're measuring self-reported health stuff. So it just depends on the organization because this program has been researched in so many different ways. But like I said, now that we know the evidence base behind it here in Wisconsin, we're taking like just basic demographic information and pre-post like satisfaction and general overall health, self-reported right now. But There's definitely links on our website to the previous research that was done on this program with other patient outcomes. And then another, it's a long answer. And then the partnership that we worked on several years ago with the Healthy Living with Diabetes program, that was there was much more in-depth measurement here in Wisconsin. And we have that report available for anyone who would like to see that report. Mary, I think that was like in 2017. I think we did the Healthy Living with Diabetes with a more comprehensive patient outcome review.
Yeah, it's something we could actually put out in Superior Health Connect so
Sure.
that people can take a look at it and give our feedback and let us know what they all think and if they need to replicate something. And also, I just want to mention today that the presentation is going to be put out there on the link that's provided by Carrie Finley in the chat. So please take a look at that, because I think the slides are very helpful. Continue to ask your questions. As you do that, Carrie, I'll ask you just simply to go to the next slide just so it's in view, but continue to ask us some questions. These are excellent questions. And as you're thinking of your questions, as you can see on the screen, this is an opportunity for you to see that not only Jill works there at Wisconsin Institute for Healthy Aging around these programs, but also another person to contact would be Amy Ryan in Wisconsin. But again, as you can see, Jill is quite familiar with other states. So if, until you can get a hold of your own connection, I know that Jill would be very able to answer some questions, or at least maybe even make some connections for you. We do have another question. Can you tell us a bit about Juniper? So I think that's directed somewhat at Jill, correct? I think, does that work for you to answer a little bit of that?
Sure, and Andreas, chime in, anything if you know more. I can tell you right now, they're very similar to Wisconsin Institute for Healthy Aging. So they administer evidence-based healthy aging programs in Minnesota. Their funding is a little different, how they structure that and their partnerships. But there is on their website availability of living well with chronic conditions. I think that's what they call it in Minnesota. It might be a different name. As well as I know, like they do our Stepping On Fall Prevention program also, and other falls prevention programs. So they've got diabetes, they've got the chronic conditions version, fall prevention. So very similar to us here in Wisconsin. So yeah, I'm happy to make connections. I've got several different staff at Juniper that I know that I can forward you. I think, oh yeah, my contact information is right here on the slide. So feel free to email me if you want a connection to Juniper. Otherwise, I'm sure even just going on their website can get you there as well. I think, does that answer the question? That was an overall answer. As far as if there's anything detailed you want to know, I can try to answer that. But
I think I want to mention too that, you're touching on it, and Andrea did too. The program itself is evidence-based. There's a curriculum that needs to be addressed every single session, but it sounds like you can name your program a little different, such as in Wisconsin, it's one way, Minnesota, a different way. And then of course we have in Michigan, it's called PATH.
Yes, and that's a really good clarification, Mary. I didn't explain that because sometimes I think, well, yeah, we all know this, but it's different. So what happens is the program itself is scripted. So the content of it, like if you're going through and you're teaching people about healthy eating, then like what you're actually supposed to say is written out in the manual. So that's why you can take it in Minnesota and Michigan and anywhere else in the world, and it's the same exact program. And then when you're trained to deliver the program, you're trained on how to do the problem solving and the action planning, and that all that behavior change stuff really happens in the training. And that training is 32 hours. So it's either 4 days in person or it's spread out throughout 6 weeks online. So there's a variety of different ways that you do that, but that's where the training comes into play, is how to do that. But the content itself is scripted. So, and then we also at Wisconsin Institute for Healthy Aging and or Juniper, or whoever is managing that license, you have to have a license to operate the program. You can't just get trained and do it. So we have the statewide license here in Wisconsin. Juniper has the statewide license in Minnesota. And so what we are in charge of then is measuring quality assurance and making sure that that program is adhered to wherever it's being delivered in Wisconsin. So we do fidelity monitoring of all of our partners, making sure that those health outcomes are going. And then I'm going to also jump back real quick, since we do have a little bit of time, to Nicole's question. And I'll answer that a little bit more with how patient outcomes are measured, how they were measured. Like I said, there's a link to the research, but I will say, so in the original research of this program, it was pre-post and then post. It was 6 months post and 12-month post. So there was right at 6 weeks post, 6 months out from the workshop, and 12 months out. There may have been some studies that were 18 months out as well, but I don't completely remember that. But I do know that those health outcomes that we said and those cost savings are matching with those post outcomes that were measured. And most of it was self-reported health, but there were some health systems that actually went and looked into the decrease in ER visits and things like that. But that was done individually.
Thank you. That's extremely helpful.
Okay.
While we have the slide up, I want to say, please continue to chat in your questions. We don't have to stop questions, but I just wanted to mention to all you that your feedback is so valuable to us, because we want to bring you programs and resources that are meaningful and helpful to you, especially in the right time. So as we develop that future content, please continue to send us some guidance, whether it's you send it in through our emails, or you can utilize this QR code here on the screen. So please take a moment to before you leave us, to create or to complete the brief evaluation. It's also posted in the chat, and as I mentioned, the QR code, and you can simply use your phone to complete this as well. We do have 2 final polling questions for this learning session, so please, if you'll put those up now. And again, start chatting in some more questions if you have them. Here's the first polling question. I learned something useful in this session. Okay, next polling question, please.
We might still be waiting for a few responses to this one.
Sure. And here we're at, all right, question 3. And I don't know if you can do this at the same time, Carrie. Can you move to the next slide? We also want to mention that we do have additional resources here to share with you. So I really want you to take a moment to review, and we hope that you find them helpful. And if there's something that we're missing, please go ahead and send us, requests, because that's what we're here for. That's what your QIO can do for you. Next slide, please. So as we come to the close, and again, we can definitely go back to questions, but we don't want to miss telling you a few updates. On this slide, note that we've made a change since the slide was created, and we are going to be coming back again next month. We're going to be talking about end of life and advanced care planning, but we've decided to make this 2-part. So that is going to cover April and May. Then we're going to move tobacco cessation to June, and chronic disease will be moved a little further out. And you can find out what is coming next in July by going out to Superior Health Connect. Next slide. So in our next steps, we would like to make sure that not only have you registered for this webinar, but it should have given you registration for the entire series. If you would like to share it with a team member, please remind them to register for the April webinar. And also, if you have not done so, sign up for Superior Health Connect. And if you have any additional questions or be interested in one-to-one assistance, we are here for you. And we have provided for you Jerry Henniker's email, who will be your contact. And are we finding any more questions? Any final comments, Jill and Andrea?
I will just say, yeah, thanks for being here. And I would just encourage you just to get the word out about this program. We did a big survey 2 summers ago about barriers to participation in these programs. And they said the number one barrier people were saying is that they just weren't aware that these programs exist. So even if you're not making referrals, to just let people know, let your teams know, let your patients, if you see patients, know just that these programs are out there, because they're extremely complementary to all the great work. And the goal is to help you guys accomplish your goals in patient outcomes, and it really hopefully take on all the recommendations from their healthcare team and put those into practice for people's daily life. So we appreciate it.
Any other comments from our Superior Health team? All right. Well, I think we can close this presentation. Thank you, everyone, all the participants for attending. And you can get our slides, as we mentioned. Please utilize the links that we've given you. And thanks for the Superior Health staff. It's another great session. Thank you, Jill, for coming today. Certainly appreciate your time and your knowledge. And of course, our own Andrea for sharing with us about Michigan and Minnesota. Goodbye, everyone.
Bye. Thanks.